There was a news article came out this last week about this absolutely crazy plastic surgery death down in Mexico, and all of these are pretty wild in my opinion, but this one was like kind of above and beyond.
Did they get a BBL?
So I don't think this one was a BBL. That's a very good guess, Sarah, and you're usually right 90% of the time on that, but this one was not. So there's a 30-year-old lady from Los Angeles who went down to Matamoros, Mexico. And remember we talked about Matamoros because they were the ones that had that weird fungal outbreak in their plastic surgery clinics. And
it was like in their IVs, wasn't it? It was like
I
in
don't
their
know if they ever figured out where
fluid?
it was. I can't remember, or I didn't necessarily see, but we talked about the Matamoros clinics.
Yeah.
They were having issues already. So this happened about a month ago. This lady's name was Tanquasha Williams, and as I said, she was from Los Angeles area, and she saw ads for this discount plastic surgery on Facebook. And throw that title segment up one more time, Jordan. It's there. You can see it there at the bottom. That's one of the ads, and I kind of got it covered with my crazy Mexico plastic surgery death. But these ads were popping up on Facebook, and I think they still are even right now. And so she saw these ads for plastic surgery advertised to be very, very cheap. So she called them up. She wanted to have a tummy tuck and a breast lift.
Okay.
And they said they would do that for $4,000, which if you're not up to speed on how much plastic surgery costs, that is dirt cheap. So the article that I read said that would normally cost $25,000. That's kind of crazy numbers. Maybe in Los Angeles.
Yeah.
Like I actually asked my office, like, what would it cost if I was going to do a tummy tuck and a breast lift? They said it'd be $15,000 to $16,000. So that came in way below the $25,000 that the article quoted, but way over $4,000.
Yeah.
So she was enticed by this really, really low surgery cost. And she went to this clinic in Matamoros, and I couldn't find the clinic name. I'm not even sure it necessarily had one. And saw a Dr. Orlando Villanueva. And this guy is on social media. He's not like big or anything, but he did have a social media account or two out there. And so, and actually they did a picture. They put a picture of them together on, I think it was his social media or hers. Yeah, that's the doctor in the middle, and the patient there on the right, I believe, is her. Mm-hmm. And that's the day of her surgery. So,
oh goodness. She
goes into surgery to get a tummy tuck and a breast lift, and she dies during the operation. And they, I think they end up doing an autopsy. I don't know if they figured out what exactly happened at the time, but she died from rupture of multiple blood vessels in her chest and her abdomen. So I can break this down. I can break this down for you, because if I told you that, you might know this because you've been on the show for so long. But the average person, if they said, well, how would somebody die from multiple ruptured blood vessels in the chest and abdomen from plastic surgery? Most people probably wouldn't know. But I could tell you with pretty good accuracy what happened. So it's very common that when I do tummy tucks, I'll do a little bit of liposuction to kind of even things out on the abdomen to make it nice and flat. And that's kind of like the very first thing I do. So it is possible with that liposuction cannula, when you're sucking out the fat, to get in the wrong place. Yeah. And remember Dr. Roxy, that girl that was like the TikTok doc or whatever, and she was like live streaming and she was lipoing and she punctured someone's intestine. Remember that? Well, that person ended up going home and actually like 12 hours later got sick. This person literally died on the table, which means that this was massive trauma. I mean, almost like she had gotten shot or something. This guy took that liposuction cannula and like got into her chest and probably punctured some of the really big blood vessels around the heart, maybe the heart itself or the aorta, in addition to the abdominal wall muscle.
Why would you do liposuction in your chest?
Well, he just got in the wrong spot. This is a catastrophically bad error. I mean, to the point that it's beyond malpractice and should be criminal. That Dr. Roxy, got careless and she slid that cannula too deep and punctured an intestine. I mean, this guy was way worse than that. I mean, to the point that it's almost like just a murder.
Yeah, what are you doing?
Like what are you doing? Yeah. I mean, if a person does liposuction their whole career, they really should never have an incident where they get into the abdomen. I mean, that should never happen. It might just be bad luck or scar tissue or whatever, but it really shouldn't happen. I mean, it means that you're just way out of bounds. This is like not necessarily out of bounds, it's out of the ballpark. Like this is, you're in another state. I mean, that is just terrible. So yeah, she actually died on the table, which means that it's just massive trauma. And the story gets worse from there. If you can even believe the story gets worse. So the Mexican government came to the family and told them that neither the doctor or the clinic was licensed. Like they had no license to do surgery.
Ew.
Yeah, I mean, how crazy is that? I mean, we've
It looked like a family, somebody from her family was with her in that picture. Wasn't?
Yeah, I
right?
think there was family with her. Yeah.
Yeah.
So the Mexican government tells the family that neither this doctor, what's his name, Orlando Villanueva, or the clinic that he was at was licensed to do surgery.
So he was like a doctor, just like a.
I guess. I
An
mean,
MD
and that's the thing that makes,
general
and that's what
medicine.
makes medical tourism so dangerous, because here I am, a plastic surgeon myself, and I'm trying to look up this clinic and I'm trying to look up this doctor, and with all the information and background that I have, I couldn't figure out who this guy was.
Yeah.
Like I couldn't figure it out. I couldn't tell what kind of doctor he was or where he trained. Like if I can't do it, what chance does the average American have to figure this out if these clinics or these doctors are legit?
Yeah.
I mean, they have no chance, no chance of knowing, is this person really properly trained and qualified to do this? Is the facility properly certified to do this? And it's just what makes medical tourism just so.
I wonder how many surgeries he's done and gotten away with it.
Who knows? Or like, what kind of doctor was he? I mean, it's just insane. I mean, I talk about this literally all the time, and I guess I'm just gonna have to talk about this my whole life, about do not do medical tourism. It is so dangerous. We are constantly talking about bad outcomes, death, like people getting, butchered, like botched by these, physicians in other countries. And it's not to like dog other countries, but they're just not the regulation that we have in the United States. I even talk about how it can be hard in the United States to figure out who exactly is properly trained, because even the United States have, general surgeons or OBGYNs doing cosmetic surgery in their office. And, it's hard to tell in the United States who's who, but in another country, like you just really have no chance of knowing,
Yeah.
And you may get lucky and you may get cheap plastic surgery and it may turn out all right, or you may die. And, I mean, it could be anywhere in between.
Yeah.
And not to say that there's not risks of, death in the United States, but we see, it's like, remember when we talked about the Dominican, and it was something like 100,000 times more likely to die from, no, it wasn't 100,000, but it was an insane number. It was some insane number that, like, in the United States, your risk of death from plastic surgery is like 1 in 300,000.
Yeah.
In the Dominican, it was like 1 in 3,500. So I guess it's 1,000 times higher risk that you would die from surgery in the Dominica versus the United States. Like those numbers are just like they're not even comparable. I mean, if it was like, 1.5 times increased risk, okay. 1,000 times, like that's insane. It's like if you said, you drive this car, your risk of death is 1,000 times higher than if you drive this other one. Like you would never get in that car.
Right.
Like there's no reason that you would ever do that. So, but yeah, this is just another good example of how medical tourism is just dangerous, and so it's hard to
It's super scary.
Yeah, definitely. All right, so I just want to do a quick recap on this segment that we did today on Nip Talk. We were talking about the crazy story of this poor lady, 30-year-old from Los Angeles, that went to Matamoros, Mexico to get plastic surgery. She was going to get a tummy tuck and she was going to get a breast lift at this insanely rock bottom prices. But unfortunately, during the operation, the big vessels in her chest and her abdomen were punctured, most likely from liposuction that was happening at the time. And she unfortunately died during surgery, which is very tragic. And then it gets worse from there, because the Mexican government came back and said that the surgeon, Dr. Orlando Villanueva, and the clinic he was at was actually not licensed to do the surgery. So it just goes to show, once again, as we've talked so many times on the show, how dangerous it is to engage in medical tourism. It's almost impossible to find out if these people are properly trained, properly licensed. So please don't do medical tourism. It's just not worth the money you might save. You could end up with a very bad outcome, or even with death. So.
Whenever I go to Mexico, I'm gonna see if there's any.
Are you gonna pop in?
Weird, like
When you going to Mexico
like
soon?
not hospitals. Yeah, in June, May.
Oh, nice.
May.
Vacation?
Yeah.
Nice.
Yeah.
Where are you going?
Tulum.
Oh, Tulum. Probably not a lot of plastic surgery places in Tulum.
Probably not.
Isn't that out in the sticks?
It's like south of Cancun or something.
I think I've been there. That's the one that's right by Cancun?
But it's south.
Yeah, it's like an hour or something. Yeah, we did that one year.
Yeah.
Yeah.
I think it's more of like a resort town. But there could
But
be
you're
like
staying in Tulum or in Cancun? Okay.
Tulum.
Yeah. Well, be careful in there.
Yeah.
I'll have to hear about this. That'll be awesome. How long are you there for? A week?
Just a weekend.
Nice.
Or I guess like a 4-day.
Awesome.